Doctor, something's wrong with my cat. Whenever it tries to urinate, it cries out in pain, and when it does, it's bloody.
Well, based on the blood in the urine and the painful urination, your cat has feline lower urinary tract disease. To be more specific, here is an x-ray that was just taken of your cat. So here's the here's a picture of the cat, spinal cord and such, and so over here is the bladder of the cat. And so here in the bladder is a single urolith, which means your cat has urolithiasis, which caused the feline lower urinary tract disease. Now in a healthy cat, the lower urinary tract is innervated by peripheral nerves that involve the parasympathetic, sympathetic, and somatic nervous systems. In parasympathetic pathways, there are parasympathetic preganglionic neurons that innervate lower urinary tract that are located in the lateral part of the sacral intermediate gray matter. Parasympathetic preganglionic neurons send axons to the ventral roots to the peripheral ganglion, where they release excitatory transmitter acetylcholine. Then acetylcholine can excite various muscarinic receptors in the bladder smooth muscles, leading to bladder contractions. Okay, so here's a picture of it right here. Here's your spinal cord in the sacral region, and over here is the pelvic ganglion. And so acetylcholine and ATP are energy. So they come over here to the anti-muscarinics. This is like your receptors I was talking about. And since they excite the receptors, it causes the bladder to contract. And this is the nitric oxide, which also acts as an inhibitory and causes the cyclic GMP, and which in turn causes the urethra to relax. And so basically it's just saying that it comes from the spinal cord, and he said those things that excite makes the bladder contract, and those that inhibit makes things relax. And so in sympathetic pathways, there's sympathetic outflow from the rostral lumbar spinal cord that provide a noradrenergic excitatory and inhibitory input to the bladder and urethra. The peripheral sympathetic pathways have ganglionic transmission, which is mediated by acetylcholine acting on ganglionic-type nicotinic receptors. Sympathetic postganglionic terminals that releases norepinephrine elicit contractions of the bladder base and urethral smooth muscles and relaxation of the bladder body. Okay, so once again, here is another picture, and this is the sympathetic pathway. So here's the spinal cord once again, and you're here in the thoracic and the lumbar region. So it sends a signal and comes to the inferior mesenteric ganglion, and like I said, there's the norepinephrine, which acts as both excitatory and inhibitory. So it comes over here to the beta agonists and the receptors in there, and it causes the bladder to relax. So there's your inhibitory, and there's your excitatories. Comes over here, causes the urethra to contract. Okay, so in somatic pathways, somatic efferent motor neurons innervate the external striated urethral sphincter muscle and the pelvic floor musculators that are located along the lateral border of the ventral horn and sacral spinal cord. Somatic nerve terminals release acetylcholine, which acts on skeletal muscle type nicotinic receptor to induce a muscle contraction. Okay, so once again, here's your spinal cord in the sacral region. Sends the signal with acetylcholine, which I said before which excites it here to the nicotinic receptor, which causes the striated urethra muscles to contract. Okay, so the feline lower urinary tract disease is disrupted the voluntary control of the micturition and cause the reemergence of reflex micturition, resulting in bladder hyperactivity and incontinence. So basically it just disrupts all of what I just said, like those muscle systems. And the urolithiasis is caused by the buildup of ash and high mineral content that is found in most dry cat food. And so thus, like I said, here in the bladder, in your cat, the urolith is formed. Thankfully, sir, this disease can be treated. I would first recommend changing the current cat food that you have to one with a lower amount of minerals, or just switch to wet cat food altogether. And then there's medicine you can give called prazosin that can be administered to relax the internal urethral sphincter. And if the obstruction caused by the urolith is too great, we might have to perform surgery to remove it. But with a little help, I think your cat will be just fine, sir.
Thank you, doctor.
Oops, thank you for coming in.